South Africa faces a severe shortage of medical professionals in state-owned hospitals, with over 800 qualified doctors reportedly unemployed due to budget constraints. Good evening, welcome to Unfiltered. I'm Sizwe Mpofu Walsh. SAMATU, the South African Medical Association trade union, has raised the alarm, criticizing the Department of Health for failing to retain these practitioners. This scarcity contributes to the emigration of skilled doctors, further straining South Africa's already struggling healthcare system. While the government acknowledges the issue and urges registered doctors to step forward, the lack of a clear retention strategy, coupled with poor working conditions, maintains significant challenges in the South African healthcare system. So tonight we ask, is there an unemployment crisis among doctors in South Africa? Joining us for this conversation, in studio we have Dr. Cedric Sihlangu, General Secretary of SAMATU, and on Zoom we're joined by Dr. Sianeliswa Shozi, an unemployed doctor. We also have Dr. Percy Mahlati, Deputy Director General for Hospital Services from the Department of Health. To begin our conversation, I'd like to speak to Dr. Shozi to ascertain his experiences to ground our conversation this evening. So Dr. Shozi, thank you very much for joining us. And could you just begin by explaining what you have experienced as far as this crisis of doctors coming out of community service and not being able to find placement within the healthcare system is concerned?
Thank you for the opportunity. As an unemployed doctor, one of the major issues that we face is that there's such a lack of communication from all parties. We apply all the time, going for far-off areas where we send our CVs. We apply to rural hospitals. We apply to places. For myself, I've been unemployed for about 9 months so far, and I've been applying for a majority of that time. And I've not been able to get any satisfaction. And so even in terms of interviews, there's very few interviews which are called. To our colleagues who have been called for interviews, very few of them have been placed. To those who've been placed in positions, they find out that their posts are frozen and then they have to continue being unemployed. So it is a very difficult situation that we are in. To a lot of us, we have basically almost finished all of our resources, our savings that we've had during the time that we were community service or interns. And coming out of this entire system has then compromised even our savings. And another thing which makes it difficult is that we're always told about we can go overseas, or doctors being unemployed can maybe open private practices. Some of us have open private practices and the money just goes down the drain because we're in an economic crisis. So people are not able to afford private healthcare as well. And then those who are suggesting overseas, it's a costly process as well to go overseas. The smallest quota I was able to get personally was 35,000 Rand, and it takes a plus minus 6 months or even longer to get your visa and all the other required documents. So we're basically stuck in no man's land, and it is a very painful situation.
Talk to me about the painfulness of it and the impact on your mental health and your sense of self, because I mean you've done all this hard work to become a doctor, you've got into the medical schools. What kind of toll is this taking on you and others like you in this position?
So the major problem is that for people like us, it is very difficult even to gain other sort of employment. I think the major problem is that it's hard to make money outside of government work. You might try to go for shift work and find out that shift works are full. You go for locums and there's only so many doctors who are going to be able to give you locums. Mental health, a lot of us, even in medical school, struggle with the strain of medicine on its own. And now we are being put in a similar situation whereby we are not able to get any relief without work. Without anybody to talk to, because we are not sort of like, we don't have any support. There's no support system for unemployed doctors, which makes the process even more painful. I myself have needed to go to counseling at certain points in time because of this issue. And of course, you can't even afford it, so you have to drop out. So you're just in a whirlwind of pain in that in that point. And just, yeah, as an unemployed doctor is not good. But also even as employed doctors, because when we are unemployed, there's nobody to work shifts. So I have friends who are currently employed who work shifts that are not even paid for because simply they want to save lives. There are doctors who, because of the strain of them being employed, they have to not take any post call. They have to work 8 hours during the day, work 16 hours during the night, and work another additional 8 hours. When there would be enough doctors that they'll be able to cover for those practitioners who cannot continue working after 40 plus hours awake and not being able to take any sort of a break. So it is really crushing both us who are employed and also crushing the mental health of those who are unemployed as well.
And Dr. Shezi, you want to serve. It's not a question of wanting to go to a specific place, whether it's a rural hospital, whether it's an underserved community. You're actually keen to be a doctor to contribute to the healthcare of South Africa in any way possible. We've effectively got a group of doctors who are ready to serve, but we can't get them into the system.
Yes, and this is a major problem, especially for the people who want the service delivery. I myself have worked in a rural hospital. I was in Flagstaff last year before I was unemployed. And there, the resources are very, very minimal, but the impact that we make by actually being there is great. We go on campaigns, we do outreaches, we're able to help the far-flung areas in South Africa, and we are still willing to do that. There was this notion that we saw on social media recently that was posted by the National Department of Health on Twitter and on Facebook, saying that doctors have this tendency to not want to go to rural hospitals, which is an absolute lie, and it's a fraudulent mechanism to try and divide the people of South Africa from supporting their own healthcare by having doctors who are willing to be employed, and the government making excuses because of their own lack of unpreparedness, of which they did know about the numbers. If you do not know, we have ICSP, which is a system which is used to place doctors. So they know exactly how many doctors will be ending community service. They know how many posts they need to open up, but there's no planning that has been done. And that is, I think, is one of the most frustrating things, that we are willing to stay in our facilities. Our previous bosses were begging us to say, please try and stay. You know, we handed them their CVs, and then they campaigned for posts to be made. And our previous bosses, they couldn't get those posts because there was no money. When the posts would open up, they would be frozen once again, and we would not be able to get employment. And so there's that issue that we're having, and there never seems to be any resolution. Even in previous meetings with SAMA, we spoke about these issues, and the representative of Department of Health behaved like it was the first time in hearing this. And this is very frustrating, that you are being told that people who know all the statistics, now we have to come forward and fill in forms again when they are fully informed about how many doctors there are, because we are all made compulsory to go through 2 years of internship and 1 year of community service. So for 3 years, they are not able to plan exactly how many doctors they will need in 3 years' time. And for me, it's really quite unacceptable.
Thank you very much for helping us set the scene, Dr. Shozi, and for just hearing the experiences of someone at the center of this crisis. Dr. Mahlati, thank you very much for joining us as well. Of course, we have a long show tonight, and we will be able to get more detailed responses from you. But could I ask for just your initial responses to the experiences of Dr. Shozi and what they represent more broadly for doctors in his position?
Thank you very much for the opportunity. And I think my initial comments would be that we fully, sympathize with the situation. We are aware of the challenges that are faced by young doctors who have just completed community service. We are also fully aware of the reality of budget cuts that have taken place, and they affect every government sector. And one of the things that, where we basically have done has been to make sure that there is representation at the highest level even with the two ministers of health and finance discussing about the need for the protection of frontline workers, not only doctors, many others, and I've made a statement, I wrote a few days ago to say that actually the rehabilitation professionals are worse off than doctors. That is not to reduce the importance of employing doctors. If we had enough budgets, we would really wish to employ every doctor who graduates from medical school who wishes to work for the public health sector.
Right.
But the reality is that the financial situation is a serious challenge and it's a countrywide problem.
Okay, Dr. Slangu, from your perspective as a union that represents healthcare workers in this predicament, what are your quick reactions? And of course, after the break, we'll come back to unpack more.
Thank you very much, Sizwe. I think we, this time around, welcome the attitude being displayed by the National Department of Health that we got to acknowledge the problem. Because the problem that we're having is the National Department of Health will come and want to downplay as if there's no crisis, to downplay this issue as if there are no problems that unemployed health professionals are facing, including nurses and others, correct. But critically, we've mentioned, because we represent doctors, that there are a lot of doctors who are at home unemployed when they're actually willing to go and serve our communities. So I think that part we really welcome.
Absolutely. And your reaction to Dr. Shozi's experiences, is this something that you think is widespread beyond his story and something that really is going across the sector for doctors in that specific position?
Look, Dr. Shozi is spot on. The issues that he articulates so well are not only his own experiences, the experiences of many of our colleagues, the doctors that we represent, they articulate the same issues because indeed, unfortunately, for these young doctors, the desire is to go and serve. In fact, many doctors go to medical school because they're inspired by the communities that they come from, and they've got a desire to want to go back and serve those communities. So it's a travesty, really, for a government to then say, well, we can't afford you opportunities to work, cross the border and go and find employment elsewhere. It's simply unacceptable. Indeed.
We are going to go to a break. Dr. Shozi, we want to thank you very much for taking the time to share your experiences on this matter. We are discussing South African healthcare workers and particularly doctors who come out of community service and the crisis that seems to be engulfing that sector, where we actually cannot place the doctors that we have who are ready to serve in posts because of budgetary constraints and just a lack of demand for these positions within government's budget. Now, we'll come back after the break and ascertain exactly what the number of doctors in this situation is. We'll survey some of the numbers that have been bandied about in the media and also come back on some of the questions of the budgetary constraints that have been raised by the department. Stick with us. We'll be back after the break. Welcome back to Unfiltered. We continue our discussion about the crisis of doctors coming out of community service without placements in the public healthcare system. Our public healthcare system needs all the support it can get, and we have talented, trained doctors in our country. However, budget constraints mean that many of them are actually unable to find placements in our healthcare system, in the public system at the moment, and we have a diverse panel of experts joining us on that. Dr. Mahlati, can I come to you now to just really get a sense of the numbers here? How many doctors are we talking about? Because Samatu, of course, has come out with this number, or some reporting has been looking at a number of about 800. Do you agree with that number? Or if not, do you have your own set of numbers which help give us a sense of the scale of the problem?
No, thank you. But let me first say that I hope that we're not going to reduce such an important, serious unemployment problem that we face in the health services, reduce it into a numbers game. I don't think it would be appropriate for us to do so. We certainly do not agree that, the numbers that have been bandied around are actually correct. but we don't want to be focusing on that. What we want to focus on is to really engage, as we've been engaging with the provinces, to make sure that they do the best that they can to actually employ, doctors. Maybe one thing that I need to address, which was raised by Dr. Shozi earlier on, there is no funded doctor post that should be frozen. It is actually against, a regulation. So if that has happened in the Eastern Cape, we would actually have to then deal with that problem in the Eastern Cape, because even in terms of the DPSA circulars that came out when there was this issue about freezing of posts, the frontline health workers were actually, were spared from that. So if then there's been a creep, of where things are not done correctly, then we'll do so, because we've never had reports from the provinces. The other issue really that I would like to raise is that from the PESAL report, that is where we actually get the list of people that are employed. Last year, if we take from community service officers, interns, and those medical officers that do sessions, and those that are full-time employed from grade 1 to grade 3, the grand total as of December 2023 that is employed in public service is 17,155. That is the number that we have. There has been some contestation about we being asked how many doctors are unemployed. And we've actually explained that it's difficult for us to know how many are unemployed, because not every doctor wants or wishes to work for government. But for those who have applied, we'll do our best as the national department, because we do policy coordination, to engage with the provinces and make sure that as many of them are employed as possible.
Dr. Sihlangu, let me come to you, because the department's position is it's hard for them to understand the numbers. They don't want to reduce it to a numbers game. How do you respond to that stance?
Yeah, well, it will be easy for us to know, because we represent doctors. So it's the unemployed doctors that come to us, voluntarily give us their information to say, I'm Dr. So-and-so, here's my ID number, here's my PESAL number, and here's my HPCSA number. Kindly help me find employment. So in fact, because we anticipated this, around about November, December, we sent out a communication to all our members and non-members to say, look, because we anticipate that come end of your contracts for community service, there's a likelihood that government is not prepared for offering you employment. So kindly ensure that you provide us with your details so that when the time comes, you can just tick that, yes, I'm now officially unemployed. And that exercise was conducted properly so. So that gave us a number of 825 people who came forward to say, I am out of a job. The acting DG of the Department of Health then said, can you kindly provide us with that data so that we can verify it with our own database? And they came back to us to say, look, we agree with these numbers. We, in our own database, meaning the National Department of Health, we see about 730 plus unemployed doctors. Those who have officially completed their community service, who have raised their hands and said, I'm out of a job, kindly help me find employment. So indeed, for us, we feel that that exercise assists, and it should assist the department as well, have an idea. It's not acceptable for a department that is having an HR responsibility to ensure that, let me just go back on one thing. Health in this country is a fundamental, or it's a basic human right? Now, the communities where 80% of our population rely on public health, it's the far-flung areas, those who can't afford private health care. So a National Department of Health has got a statutory responsibility in terms of the National Health Act to ensure equitable access to health care. So it will not be acceptable for a department that is vested with that authority to simply say, well, we don't know. We'll see to finish as things go. You gotta take a proactive approach to ensure that you know, so that you can place or afford doctors employment appropriately. I'll give you an example. Because of the issue of crime in this country, and we all realize that crime is an issue, what do? We up the number of training police, right? And what happened last year, we had about 20,000+ police that actually graduated. What did we do? We put them in the various police stations, right, to actually render services. It would not be acceptable for trained police to then go find employment as security guards somewhere. That's what the National Department of Health is saying.
Let me, and I will come back to you, Dr. Shozi, for your perspectives, but I saw you disagreeing there, Dr. Mahlati. Why do you disagree with Dr. Sihlangu's suggestion that if we do have the doctors and they are unemployed, we should find places for them, given the humanitarian imperative of our healthcare system and the need to meet the massive demands on that system with trained doctors?
Yeah, Sizwe, I was trying to avoid to get into a numbers fight, but since Dr. Sihlangu has actually moved into that, let me deal with it. Of the 825 they gave us, 694 had already been placed. And the other issue is that the provinces advertise, a post. Some of that 825 they gave us, I remember 2 were already in employment as of July last year. So to actually then say that, look, we do not know, we knew. And provinces advertise. Dr. Shozi was correct. They get invited so that they can actually be interviewed and be placed appropriately. Those are provincial processes that actually take place. It's not that, we do not know. We know because we know how many community service officers, are actually finishing their program. We fully agree about the need to staff every facility. But we can't run away from the fact that if you don't have a budget, you can't employ somebody. It has happened before that junior doctors were employed and there was no salary to give them for up to about 4 months, where there had to be major interventions. So we're then saying, even if there is a crisis, please don't worsen the crisis by allocating somebody to a post that has not been budgeted for. What we should actually be doing together with the professional associations is to make sure that we actually put a lot of pressure on the health budgets to be protected so that we can employ more. It's not that we don't do planning, but I do know that people become emotional about it, want to act as if we don't know what we're doing. We do know, but the challenge is that you cannot do something that is not out of budget. PFMA does not allow it.
Right. Let me bring Dr. Shozi in, and I know that this question about the number will come up. Just a reminder that we have a long show ahead of us, and we will get to canvass all of that. But Dr. Shozi, how do you respond to the conversation so far? We're focusing on what is the scale of this problem, and we've heard differing views on the actual number of doctors that are affected.
Look, thank you for this opportunity again, but I really feel that the Department of Health is trying to save face at this point, because they are saying that we are being emotional about things. That for me personally, the truth is that these budgets are released every year, and they knew about the problem when the year started. When I was in community service, if they say that they knew and they were not able to plan or make according, they were not able to go out, find the funds so that they can employ people appropriately. It is not enough to say that, okay, we didn't get enough budget, so therefore we will not be able to get everybody a job. But hey, at least we knew. That is what the response, I think, from anybody who's unemployed in our position. By saying that there's 600 placed doctors doesn't mean anything, because from those of people who have been actually placed for positions, who we went to interviews with, they were told that, okay, they were placed, they were told that, okay, we want to put you in, for example, pediatrics in this hospital. And then when it's time for the employment to happen, they are told you can't start working because the budget has disappeared. So for you to say that you are placed or not placed or anything, it doesn't make a difference. Those people should be on the list. Those people should still be given jobs, and as soon as possible, those people should start working. I really don't see what satisfaction we get from saying that 600 people might have, 600 people are qualifying for jobs, or they have some sort of placement, we know about them, when there's no actual way forward of an actual budget. And these budgets, they're actually in the hands of government. It's not as if We are talking about different people who are waiting from a grant overseas. This is planning which a government is supposed to do. And it's not just from us as doctors. We realize that this problem is across the board. But for the budget to once again strike even the most critical of issues in the country, which is health, I feel that it is an embarrassing failure on behalf of government. And can they please save themselves from this embarrassment and try to employ healthcare workers? That's the only response I can say. We cannot be limited to the fact that, okay, we don't have enough budget when they had the time to get it.
Dr. Slangu, I hear, and of course I'll give Dr. Mahlati a chance to come back. The question of the scale of the problem is quite important because the number of doctors matters. If we could have more doctors helping people,
of course,
and we just don't have the money to do that, then that becomes another question for the government about how we've got into this economic situation. But Dr. Mahlati tells us, actually, no, 695 doctors have been placed. You tell us 700 or so haven't. It's hard to know, who's right here.
Yeah, perhaps it speaks to the state of disarray of that department, because Dr. Mahlatu's senior, the office of the DG, to which he reports to, responds to us and indicates that we agree with you, Samatu. As of the 1st of January, this list that you're presenting, we agree that these people have just completed community service, 31st December. And it confirms that when a doctor says, yes, I've completed, but I'm unemployed, why would you want to disagree with that when your superior has in writing confirmed that? It's very strange. But I want to come to this. We are not in a, we are in a unitary state in this country. It's not a federal state. So the notion that one arm of government suggests, well, there's no money, and then you throw your hands in the air is not acceptable. I'll give you an example. There's a budget council which comprises of the Minister of Finance and the 9 provincial MECs of Finance. You've got National Health Council, which is the Minister of Health, and the 9 provincial MECs for health. Beyond that, you've got an extended cabinet where the president sits with his coordination council. Now, a government, we're not talking about an arm or wing, a government, surely which is responsible and responsive, would be able to consider the needs of the country, understanding that indeed health is a basic human right, and therefore prioritize it. We've bailed out SAA before. We've bailed out Ports Company South Africa, billions. We've bailed out Eskom so many times. You want to tell me that a responsible government will fail to bail out the poor, the indigent?
Right.
It doesn't make sense.
Let's go to a break. We're going to continue this conversation, which is about the extent of the crisis of doctors who come out of community service, ready to serve the country, but don't find posts across the length and breadth of the country into which they can employ their services. We're having a wide-ranging discussion with both the Department of Health, affected doctors, and the relevant trade union to get to the bottom of how deep this crisis goes and how we can come out of it. When we come back, we'll put some of the counter-arguments about the realities of South Africa's budget to our guests. Stick with us. Welcome back to Unfiltered. This evening, we're looking into a crisis around doctors who come out of community service and are unable to find employment in the public healthcare system despite wanting to go into that system after the long period of their training. Dr. Mahlati, can I come to you? Before we went to the break, we were having this conversation about what is the scale of this crisis, what are the numbers involved. You suggested that, in fact, most of these doctors that are alleged to not be able to find posts have been able to find posts, but also just gave us a sense of the reality of the budget. And of course, our other two panelists disagreed vehemently with that position. Would you like to respond again in turn?
Yes, thank you very much. First, let me just complete on that 824. Some of the list of the people in that list are only completing their community service end of March and end of April. So to put somebody who is yet to complete the statutory requirement as being unemployed, I think is being disingenuous.
How many
but
of the
like
list?
I said,
how many of the list are in that position, Dr. Sihlangu? How many of the total list are in that particular position?
those will be finishing around March and April. I think they're about 12 or so.
Okay.
So the number might look small, but the principle is actually what I'm actually, raising. But like I had said, I don't want this to be ping pong about, where the numbers and all. Let's deal with principles. Maybe let me share with you what it is that we are doing to try and alleviate this situation, because that is what to me is more important than the kind of fight we'd have. The issue around the budget council, National Health Council and all that, that's exactly what I meant when I said representations to National Treasury are actually done even at the highest level. So what Dr. Sihlangu is saying is no different from what I said. It's only that I did not mention those bodies, but the minister has taken it upon himself. And I know that Dr. Sihlangu can actually verify that with the minister if he so wishes. So it would be important that some things we don't distort. The internal measures that we have, one of the things that is a challenge is that you've got fewer people that are in, you spend a lot of money on them, especially on overtime. On overtime for doctors, we spend on an annual basis upwards of 6 billion rands. So what we would like to do is to make sure that we make rearrangements, for that, so that you can free that money to employ more of the young doctors. But you can imagine that they were getting opposition from some groups, because they feel that their members are entitled to overtime, even though overtime is actually a service prerogative that needs to actually be sorted. So the internal measures that we are trying to put in place so that we can create more space within the resources that we have in the provinces for the provinces to employ more people. As we speak now, Limpopo is sitting with 166 applications that they would like to actually, make the appointment, but unfortunately, because of some other issues that I may not, go to detail on, they're unable to do so because of some court processes.
Right.
So these are the issues that we're saying we're trying to respond to the emergency that we have, and we need to deal with that particular problem.
Dr. Sihlangu, how do you respond to that?
I'm not sure which part, because I think to the extent that Dr. Mahlati confirms that when we speak of representation to be made, we're not speaking of a part of government. We should be speaking of government in totality, because it is the government of the people and it must serve the interests of the people. So on that score, yes, we are in agreement. I think maybe to touch on one aspect that he goes to, the notion of the Limpopo Department of Health not wanting to open up posts because there's some obscure court process. That's completely untrue. Now, a court interdicted Limpopo from unilaterally wanting to change conditions of service for doctors, right? Samata took Limpopo Department of Health to court because of an irrational process, something that it baffles the mind. And the court agreed to say, no, we got to stop this, allow process of consultation to unfold before any change can be made. So a government that then says, because I'm bitter, because Samatu won in court, I'm therefore going to hold posts and not advertise them. It shows you that sometimes leaders can be a bit petty when lives are at stake.
Dr. Shozi, you've heard the conversation as it's unfolded, especially about the extent of this problem. Dr. Mahlati tells us that some of these posts are actually doctors who have not fully completed the community service process, but the number is around 12 of them. What is your view on the debate as it unfolds?
Once again, I'm shocked. I'm shocked at the Department of Health at their responses. So, number one, So what they're saying is that 6 billion rands, which is paid in commuted overtime for doctors. That is, by the way, that is doctors who have finished their normal 40 hours of work and they go an extra mile because they are trying to cover after hours work, and they go and they work, as I said, those extra 16 hours, between 80 and 96 hours per month that you cover, and it makes up a portion of your salary. This is saying that no, we want to take that away from doctors, so they will pay these doctors less and institute something which is we've all heard about in Limpopo, about shift work, which the doctors themselves on the ground keep on complaining about. You have up to 6 months where you're waiting to fix, for example, if you break your leg, they need to do external rotation. Or if so, it takes about 6 months to get that done. They don't have X-ray machines at night, so people who have been staying all day until the night time, who have to be seen at night because that's when the doctor is available. The other shift was full of emergencies. So OPD patients are seen at 2 o'clock at night. You spend about 5 hours waiting for services to be done. You have overstretched the skeleton staff that you already have, and that's what they're saying they want the rest of the country to happen, where people are actually suffering right now, where waiting hours are more than a day in Limpopo Department of Health, and things are terrible. The doctors themselves they keep trying to apply as other institutions and be moved from that. So the doctors are complaining, the patients have been complaining as well, and it's been a mess. It's absolute chaos in Limpopo Department of Health, and that is the solution that the government is supposed to solve this issue, instead of trying to get funds from elsewhere to pay for overtime so that we are able to have a healthy healthcare system. The reason, for example, the reason why we actually stand for the current healthcare system, which is in most provinces, is because you can't function on a shift system in all departments. The only departments which actually benefit from a shift system is casualty and maybe ICU, but the rest need a majority of the patients who are critical. They will come at any time, but the majority of the patients are not yet critical, and they need us to practice preventative medicine. So we need a majority of the staff to be there during the 8 to 4, and then for those patients who are emergency, they can be handled by the emergency staff until the next day. So that is what actually helps to reduce waiting times, to reduce complications in the system. Right. And the Department of Health is saying, hey, guess what? When I employ more doctors, let's go into a situation where we're going to worsen the outcomes for patients. So it's a catch-22 situation, simply because they were not able to plan and prepare. And the only way we're going to be able to get any answers is a bailing out system. We must reject it with the contempt it deserves, this issue of shift work. There is no point in it for majority of departments in our healthcare system. And as an unemployed doctor, I'll be given pause if you're going to send me in a system that I've seen already doesn't work.
Right, Dr. Mahlati, we have a break in a minute or so I'll give you a chance to respond, but then we'll come back. We still have another segment after the break.
Yeah, quickly, I think the logic is simple. The more doctors you have in the system, the less trained doctors are going to have. I don't understand an argument that says keep doctors few, pay them more, keep others outside unemployed, and then you'll actually, we know that there is no money. That's the reality. What we are saying that we have to do an internal reorganization so that we can be able to accommodate more of the doctors into the system. So I don't understand, a debate that says, no, that is not correct. You are okay with the few doctors that you have, but still complain about being overworked and all that. We're not saying it is the most perfect solution, but it's one of those solutions that we actually have to implement.
We're going to come back for our final segment after the break. We're in an interesting discussion and debate about the scale of doctors who come out of community service and are unable to be placed in the public healthcare system. Who's to blame? What is the scale of this crisis? And how do we emerge from this problem? When we come back from the break, we'll talk about the solutions, the way forward, and how we can reach an amicable solution, not just for doctors and the Department of Health, the unions, but also for our country. Stick with us. Welcome back to Unfiltered. Does South Africa have a crisis among doctors emerging from community service who are not able to find posts despite wanting to serve the nation? That's our question this evening. And I believe that this has generated fierce debate on social media. I want to take some of the reactions. Mina Tao says, unemployment of medical practitioners is not a unique problem facing young doctors only. There are millions of young educated people unemployed as well. Why does the issue of unemployed medics have to be allowed to get ahead of other professions? Let's come to some other reactions. Tao says, there is undoubtedly an unemployment crisis of doctors, which affects mostly the disenfranchised communities in rural and peri-urban areas. And finally, Nels says, Dr. Mahlangu is lying. Provincial MECs, premiers are not engaging doctors. And of course, we'll give our guests the opportunity to reply. Let's come back to our panel and our discussion. And Dr. Sihlangu, I'm going to come to you because we of course have disagreed or had disagreements on this panel to a great extent. But I think everyone wants to reach some kind of solution where doctors who train and want to serve the country can serve. How do we get to a point where we don't have this crisis? I mean, it baffles me that unemployment is one of our major developmental goals, and yet we struggle to find solutions to the unemployment problem. He has a very obvious place where we could, not just address healthcare, but unemployment. How do we find those solutions?
Thank you very much, Caesar. I think I saw one comment about why is it an issue that doctors are unemployed. Why are we making such an issue of it? And I think, firstly, it should be an issue, as much as every other unemployed graduate is an issue. We are merely bringing it up because it affects the poor, the marginalized, and the indigent. I'll give you an example. The Social Relief of Distress grant, SRD grant, people are getting 350 rand, right? Now, to consult a private GP, if you're in need of health care, it's nothing less than 400 rand, right? So if you are relying on 350 for the whole month, and now you are told doctors have graduated, but they're all going to private practice, what that means is you'll never reach that doctor. So that speaks of inequities in health, which we, as proponents and advocates for the poor and the indigent, we say that cannot be allowed. We need a system that allows for these doctors to go and serve those communities. Of course, the department and government has come up with a lot of documents, National Development Plan, Vision 2030. You speak of your human resources for health strategy 2030. So all these efforts and illustrious documents are trying to say health is a priority and it must be prioritized, because with good health outcomes, you've got a thriving economy. So certainly, you want the young people to be healthy enough to go to work. The moment you remove the human resource component, no one will take care of the ill, so that therefore they will not be able to work. Hence, we prioritize healthcare, and I've mentioned it time and again, it is a basic human right. So therefore we must agitate, because the ramifications is not about a doctor not having a salary. The ramifications are the women that die whilst in labor because there's no midwife and there's no doctor. The ramifications are the children that die of diarrhea at home because no one is attending to the basic primary healthcare issues. So it is important. And this country must be aware that something must be done. We can't just treat this as something in a laissez-faire manner, because it is important. Hence, we are agitating about it.
Dr. Shozi, your response to some of the social media comments, and also as we look at the way forward, how can we overcome this challenge and get doctors working? How can we ensure that we aren't in this position going forward?
Thank you so much, Cesar. I think a major part of any solution here is starting the conversation, and I'm thankful that we're able to do just that. I think that the Department of Health has had a very bad administrative issue, and I think they need to own up to it, that their administration has failed the people of South Africa, not just us as doctors, and we need to have some way which we're going to make things work. But this major thing that I'm having is that comment saying about it affects the disenfranchised. And the thing is, look, I even have my CV right here, just so that you can see that we are serious. Here is my CV. Employ me, I will go work for those people who are disenfranchised. I want it to be very clear that doctors are willing to go and work and help out the poor and disenfranchised people. We are willing to go and put our own lives at stake, because that is what it means to go and work in rural areas. And finally, the greatest solution that we can have is to not just look and say that there are certain budgetary constraints that we have, and therefore we must now affect the ways which the system has been running, and the way that the system has been running moderately well. The situation whereby we shift everyone to shift work and we push people into areas where they are more likely to be burnout. There's research that can prove to you that burnout is caused by the lack of sleep. And if you're going to go to shift work, there'll be a lot more hours that you'll be doing, or 7 to 7, from 7 p.m. to 7 a.m. And those shift hours will affect the livelihood and the decision-making skills of the very doctors you're trying to employ. So the government, please do not sacrifice us on the altar of your own failures. Please do not sacrifice us on that. So I do want to be employed, but I do want to be employed in a way that is going to be helpful to both me and the patient that I'll be seeing. So, yeah.
Dr. Mahlati, how do you respond to some of the social media comments, as well as some of the interventions that have been made in this segment? The floor is yours.
I think Dr. Shoza has got a distorted view of what shift work is. Shift work is a problem when you've got few. But if you've got an adequate number, for instance, if you've got 4 doctors working, and they'll actually be burned out. But if you've got 10 instead of 4, certainly the shift work is going to be far much more easier for them from a caseload point of view. But we're not discussing the issue of shift work here, because that's another complex matter that we've got to deal with. All that I've raised, the principles that we need more doctors in the system so that we can be able to relieve the pressures and have less of unemployment. I'm concerned about the failure to appreciate the fundamental problem, which is actually the lack of proper budgets. I agree with Dr. Slangu that the budgeting for the health system has to improve. And this is what we've actually been pushing through, engaging endlessly with National Treasury and all that. So it's not that we're sitting folding our arms. I do understand that, where we've got to be targets, of the end, problems that we have. There are some sweeping statements that are made that say all doctors are willing to go and work in rural areas. If that was the case, why would we have about 200 and something that actually object to being placed in the areas that they are placed in, especially community service? So let's not, use one brush to paint everybody. However, going forward, I think it is important for us to pull our ideas together, see how we can be able to manage, including internal, retention policy reforms that must come into play to make sure that we reduce the unemployment challenge that, our young people have in the health services. Obviously, unemployment is a result of a poorly functioning economy. So unless the economic issues are actually dealt with, we will continue with this unemployment issue right across. And I appreciate when colleagues are actually acknowledging that it's not only medical doctors, and it is a pain to many of us, to actually say we need to improve situation. And if it is not improved, we are going to get people more disillusioned. You'll get less people that are capable coming into the health sciences, coming into medicine, going to other fields. It worried us as senior doctors to say we need to get more people in, but really what is important, we need to get proper budgets so that we can be able to employ more people into the system.
Well, Dr. Mahlati, Dr. Shozi, Dr. Sihlangu, thank you very much for joining us for this important debate, for a full and frank exchange of views, and for bringing the multiple perspectives that bear on this debate to the audience. We've had a very fascinating discussion this evening about a crucial part of South African life: access to healthcare for the most poor in our society remains a difficult challenge. And one of the areas that has surrounded that is this question of doctors coming out of community service. They've got their degrees, they've done the community service, they're ready to serve, but it seems like there are no posts for them to serve into. Why is this happening? How has it happened, and how do we get out of it? Those are the questions that we have addressed tonight. Let's continue this fierce debate on social media. On X, we're at Unfiltered SABC, and thank you for joining us for yet another installment of Unfiltered News, Unfiltered Views, and Unfiltered Conversations. Have a good evening.